Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. Well, what night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors. As always, we're going to go around and we're going to begin to
There we
introduce our
go.
esteemed panel, starting with that doctor who's known on these streets as Dr. 100. That's our own Dr. Maya Green. Well, Maya, people's been asking about you, and they're glad that you're back.
Well, here I am. I missed the community. I missed the fellowship. I'm
There
definitely
we go.
glad to be back. For those of you that know, I
Ooh.
was in the middle of some classes because we're always learning, and that class just happened to be Monday night, starting at 6:30. So I'm done with the class. Thankful for its success, but also thankful to be back among such intelligent colleagues in such wonderful communities. So I'm ready to get into tonight's discussion. Let's do it.
Outstanding. To the man who has that outstanding art, who always has great conversation. That's our very own Joe Harrington. Joe, Joe, you're muted.
There we go.
I can take care of that.
There you go.
Yeah. I appreciate the fact that
Ooh.
you and Congressman Davis provide us this platform to share whatever information and knowledge we have with our viewers and our listeners. My background is mostly in public health and healthcare. Worked at three hospitals, Mount Sinai, Rush, University of Illinois was the first. Worked in public health for the state
Whoa,
and the
whoa, whoa.
city. Fired in 2017 from the Illinois Department of Public Health, where I was the regional health officer for Cook County.
Outstanding. And thank you so very much. Well, to the doctor who is that weight loss guru, our Wolfgang Puck of healthcare. That's our very own Dr. Tony Hampton. Dr. Hampton.
I appreciate that, Nikki. Thank you again for the opportunity. Very happy to be here tonight. Always excited to put our voices out in the world so people can get their questions answered. Sometimes in a quick appointment, you just can't get the doctor to answer questions because it's like an assembly line. So this is the opportunity for us to answer questions. I work on the south side of Chicago, primarily a primary care doctor who just happens to focus on obesity and metabolic health. So I'm looking forward to our conversation and answering any questions. Thank you.
Outstanding. Well, to my colleague who tends to leave and go and have fun in the sun, but I wonder where he is right now. That's our very own Dr. Douglas Graham. Hey, Doug.
Thank you, Nikki. And I'll tell you, for the last week, there's been no fun and no sun. It's been mostly rain. Um, I'm a retired physician. I worked in the western suburbs of Chicago for 30 years, and then I joined the congressman in his office for 2 years. And it was an eye-opening experience. I've become interested in public health and public policy, and it's a real honor to be here with my colleagues and the congressman. And I'm going to try and answer your questions as best I can.
Outstanding. And thank you so very much. Well, to the one that makes this possible for us each and every Monday night, to the one who tells us and teaches us that true wealth is your health. That's our very own Congressman of the Illinois 7th Congressional District, Congressman Danny K. Davis. Congressman?
Soon to be retired. How about that? But let me welcome all of you, and let me thank all of you. Of course, we always look forward to Monday evenings. And one of the things that I was thinking of earlier is that health and the need for health and the need for health care will always be with us. That's something that will never go away. We will always have it. And if I was a young person looking for a career, I'd probably say, let me take a look at healthcare, because healthcare needs can't be exported. They can't go out of the country. There will always be the need. And I don't think we'll ever get to the point where we run out of the excitement of healthcare. Today we participated I participated in a great press event that Citizens Action had with and at the AIDS Foundation, where there were 4 members of Congress, a number of health advocates, and of course the president of the Cook County Board, Tony Preckwinkle. And we were there as celebrants because this is the 16th year anniversary of the passage of the Affordable Care Act. And I always say that the Affordable Care Act is the most important health legislation we have seen since the mid 1960s, when Medicare and Medicaid came into being. And so we're still kind of celebrating. Thank you all very much. And I guess the question, a big question would be, if we didn't have Medicare, Medicaid, and the Affordable Care Act, what would health care in America be like? What would health care in America be like without those programmatic aids that assist the American people to have the health status we currently have? So I just throw that out on the table and thank all of us, and it's a pleasure to be here.
Well, I'm happy to jump in because I did a little research before we started, and I was thinking about this whole issue of having health insurance and what it means in the United States, because there are significant financial and health risks, particularly if you don't have insurance and if you have to pay for your own care. And medical debt in this country is one of the leading causes of people going bankrupt. It also leads to delays in care because people feel they can't afford the care. It's a significant burden for Americans, and it's estimated that 220 billion in total medical debt is owed across the United States, and about 100 million people have faced healthcare debt in the last 5 years, with roughly 14 million people owing over 1,000 and 3 million people owing over $10,000. So if you don't have insurance, all that cost is your burden. And that not only keeps people from going in to get care because they don't have insurance, even people with insurance are afraid that the costs are going to be too high, that they don't seek care. So it's a deterrent to getting people to come in. And Dr. Hampton and Dr. Maya and Dr. Graham can all expound on that from the standpoint of patients they see and some of the issues that occur as a result of people not having gone in to see a doctor on a regular basis.
Dr. Harrington, Joseph, thank you for raising that question. One of the key elements of the Affordable Care Act is that people with pre-existing conditions were not denied coverage. So if you had diabetes or hypertension or kidney disease, you could still get insurance. And nothing had prevented discrimination on the basis of age, sex, and race. So if you eliminate all these protections, there are going to be large numbers of people who will not be able to afford healthcare insurance. And that doesn't just affect them, it affects the whole healthcare system. Because when they enter the healthcare system, the hospitals don't get paid, the providers don't get paid, the money's got to come from somewhere. So it actually has not just a domino effect, it has an avalanche effect on the entire healthcare system.
Well, let me ask this question or pose it. Since we know that no matter what providers can provide, no matter how good institutions are, how great hospitals and physicians and nurses and all of those practitioners do great work, but the bottom line is that ultimately the individual must play a great role in determining their health status. If we know that, is there any reason that we don't spend more time trying to communicate that and to help individuals know that at the end of the day, no matter what else goes on, you really have the greatest amount of control over your health? Is there a reason we're not really driving that as heavy as we can drive?
I think I'll start by saying that a lot of people have been put in a system that it does not allow for them to be successful in it. If you think about this gentleman named Deming came up with this concept. As a healthcare leader, I'm always thinking about like process. And his statement said that 93% of problems are systems and process. Only 7% are people. So when you see people failing in a world, in a system, you really want to look at the structure and the system and the processes before you look at the people. If you put people in the right, if you're why would some basketball players, why is LaMelo Ball, who plays for the Charlotte Hornets, all of a sudden being successful this year when he wasn't last year and the year before? And I think it's because they put a system around him and the right players around him. And that happened to Shea Gilgeous, who's on the best team, arguably, right now, is that so the system is more important than the individual. Even Michael Jordan had to figure this out. So in my opinion, we need to create an environment for people to be successful. And although they absolutely need to be, once you pass the baton to them in the right system, they do have to be accountable to that. But we can't expect them to be successful. If they come to a clinic in a traditional healthcare system, my appointments are 15 and 30 minutes long. And in that 15 minutes, if I really want them to understand how to heal, I have to find a way to do what the system wants me to do, which is partly to make sure they're on the statin, make sure they see the eye doctor, make all these, check all these boxes. But I already know that the most return on investment for them to heal is what they put on their fork. So now I have to, in a system that's not designed for the way I think, try to tweak it and use what I know to, in a very slick way, integrate the healing message on top of this system that's not focused on healing and disease reversal. We're a little bit into like prevention because we do all of these quality measures that should, in theory, be helpful for prevention. We do mammograms and colon, things like that. But what we don't do well is, why do you have colon cancer? Why do you have breast cancer? Why do you have diabetes? Why do you, and then focus on that. Now, if we did that as a country very well, and we put a system around people, we put them in a system where they see the doctor, and then if they're needing nutrition education, their nutrition person is not just a nutrition professional, but a coach who will not only tell them how to eat, but also coach them when they struggle. And we maybe have things, a system in place where we have blood pressure monitors at home and scales, and we communicate with them and their continuous glucose meter, all that data we can see in real time, and we can react to it, and they can react to it because they're going to change their behavior because they're in a system that's going to affect their behavior. So this is not like Scott, I'm dreaming about something. These are things that some health systems have figured out. These are things that some organizations have figured out, and we just have to figure out how to use our resources in a better way. I just don't think we use our resources very well. We spend a lot of, I'm gonna say this and I'm gonna let my colleagues speak. I had a patient I had a message today from the pharmacy, and the pharmacy sent me a message about Wegovy, and I tried to convince the patient of this before I actually did the prescription. They weren't really in a position to do a great job with lifestyle, so we did Wegovy, the weight loss medicine. And the message from the pharmacy said the patient is now willing to try the weight loss pill because the cost of the Wegovy shot was $1,600 a month. I'm like, did the prices go up? The price of the Wegovy pill was only $150 a month. And that's where what you're saying, Congressman, we have to then say to the patient, if that's the path you're going to take, are you willing to sacrifice something to spend $150 a month?
Yeah.
The problem is, can the country afford $1,600 a month? Let's just say the insurance actually covers it. How many resources can we give somebody at $1,600 a month beyond a shot that
Yeah.
can help them be successful? And I think the system is broke. And the good news is we know how to help people heal. We just have to have a system that will honor that. And that's what I'm hoping we can do with the resources we have.
So, oh, great. Was okay. Hi. Um, Kind of dovetailing off of what the congressman mentioned and kind of bringing it to what you said, Dr. Hampton. Uh, ACA increased the amount of people that had access. You mentioned people have to use the resources in order to impact their health outcomes, and those resources rest inside the system. So, what ACA did, it was, as you mentioned, signed on March 10th, 2010, I believe. And what it did was shift the amount of people who had resources to impact the system and their outcomes at an earlier point. We all know somebody that didn't go to the hospital because they didn't want to pay the bill or didn't have access to the hospital because they think healthcare is too expensive. ACA, once signed, did a couple of things. It increased pathways, made it mandatory for some pathways of health to be accessible. It put in place a marketplace where people could see what their options were. Because even now, when I go in and I'm like healthcare, it can be an abyss. It put into what we in place what we call a marketplace where people can see more options available. Up until then, people were just taking the opportunities or the options they were told were available to them. So it shifted kind of that power dynamic when people were able to see their options, get coverage for pathways to health, right? And it pushed payment delivery systems to reform themselves so that those reimbursements were coming back. But it also forced the healthcare system to cap how much, in a lot of instances, we can charge for stuff, but also support people in the way insurance is supposed to support to a greater extent. In fact, I think a little over 24 million people accessed this marketplace that there's a lot of talk about who's not using it. Well, 24 million people used it last year in 2025. So, boom, there you go. So it did create that for a lot of people. And we can see, and then, that those are the great things about it, because also naming what you said, what happens in that healthcare system is only 20% of a patient's health outcomes,
Yeah.
right? That's only 20%, according to population health models of the patient outcome. That includes the 7%. That's the doctor patient exchange. The rest of it that includes insurance, things like that. 30% is health behaviors, but those health behaviors, Dr. Hampton, like you said, are built off of the environment that is created around us, right? And then social and economic factors,
Mhm.
which insurance is impacts that. Your economic factors impact the type of insurance you have. ACA was able to shift that for a lot of people so they can get more health impact out of what they were paying for, and that's 40%. And the 10% is your physical environment, whether you have, a lot of smoke, trees in your area, things like that. So it was able to do that. And oh, I forgot the most important thing. It made a lot of prevention at no cost to the person. So
Yeah.
I want to go in and get that screening. Here we are on the screen talking about talk to the doctor, go to blah, 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 get screened for diabetes, get screened for kidney disease, get screened for HIV. Talking about getting all these screenings. ACA made it so people had the ability to access those screenings, which underscore what we do makes what we do easier. We can support patients more because earlier screening yields better outcomes. I know someone is living with diabetes earlier or has the potential to have diabetes earlier or be living with diabetes. So I can say, Dr. Hampton, go ahead and talk to them about that. Dr. Mason, go ahead and talk to them about for something. Go ahead and do all of that, so that I'm not writing Ozempic. I'm not writing those things down the line, so it shifted the health access and possible health outcomes for a lot of people, a little over 24 million people last year.
Yeah, I want to jump in and pick up on what was said in the sense that I think you're both right in terms of what you say. There are two things about this issue of healthcare in terms of what we're talking about access. There's this idea of access, and then there's this thing called utilization. How many people actually use the system the way the system is designed? I'm not blaming people on that, but there is a significant drop off on routine health screenings after the age of 20 until about the age of 50 when diseases start to appear in terms of symptoms. So now you have a symptom and you go to the doctor and the doctor tells you have a problem. Maybe you have a cancer that could have been caught when you were 30 years old. Maybe your heart is not functioning the way, and you might have had a condition that if you had been seeing the doctor, and I'm not blaming people for this, year after year, getting your annual exams, getting your annual screenings, that could have been detected earlier. So part of the paradigm, we can't blame the system and we can't blame the individual. It's really both. It's the system in terms of sometimes there are barriers to access. Money might be one, location might be another, and some people's habits might be another. One of my good friends, Dr. Paul Crawford, a nephrologist whom I met a long time ago, he would always say that our people suffer from what he calls the I feel good syndrome. James Brown's song, I feel good. I feel good, so I must be healthy. You don't know that. The only way you know that is to be in some type of regular care where you're getting the examinations and the tests to identify a disease early so you won't have to have a dramatic incident or you might have to have a more expensive procedure down the line. So it's a double-edged sword. Yes, there's more utilization, but still a lot of people that need to take advantage of it are not until they have a problem. And that's also a problem.
If I can just jump in for a little bit, I think also we have to deal with history. Historically, healthcare has been kind of presented as something that you seek when you are in trouble, when you are sick. And so and I think we're in today's world we're trying to as much as we can to replace that that thought process with the idea that like I said, if you had a car and you had a son or grandson, I don't think you just let them take over driving the car without teaching them to drive and making certain that they understood the things that they need to do in order to be able to take care of the car and take care of themselves. The same thing, you can put a person in a system, but if they are not used to the system, they don't understand the system, and their ideas is that, well, a patient used to tell me all the time, well, I come to the doctor when I'm sick. And so that was their idea. I only need you when I'm sick, and if I'm not sick, I don't really need to see you. Not understanding that disease processes start, and before it makes them sick, there's opportunities that we can possibly do something to arrest the disease and maybe prevent them from having some of the issues with their health that they otherwise are going to have, but could prevent if we did different kinds of things in terms of teaching them what they need to do themselves, as well as the care that they need to seek. But I think that history, is an important thing, and so that's and that's one of the very difficult thing is to sort of erase the thought process that people have, and to get them to think in a new way in terms of how they're going to utilize the system. So I think that is part of it. And I do say that the availability is so important, because if it's not available to that individual, whether the system is there or not, but it's not available to them for whatever reason, whether it is that they don't understand how to utilize it, they don't have the resources, they don't have the finances, that too will create the same kind of problem, that you have a sick person or you have a person that could do something to maybe prevent themselves from getting sick, but do not know how to do that. So the system may be the greatest system in the world, but it's not really effective for that particular individual who does not understand how to utilize it.
So you can have the resource, you can have the facility, but if the individuals are not taught appropriately to make use of them, then they're kind of just there.
Just there, right?
It's kind of like my daddy used to say, you can lead a horse to the well, but you can't make him drink.
Yeah. Oh. Yes, Congressman. And just to reiterate, ACA was signed in 2010. So, let's look at that. And on average, it takes 10 years for a population as a whole to be aware of how to use a resource. And then more and more people start using it. But we do have, and why we don't use it: lack of trustworthiness of the healthcare system, lack of aware historically. So it can be there, and we'll be like, let me see what happens to other people, or we weren't aware that it was there or what that kind of means. Because remember, when ACA was first signed, there was a lot of attempted rebranding of the narrative of what ACA was, right? So say I was a person that was not a fan of President Obama, then I did not engage in Obamacare, as they were calling it, even enough to understand that it would benefit me. So there were a lot of layers to why people didn't access it. But we do have evidence as to what happens when people don't access it or do. And that evidence is embedded in what we call expansion and non-expansion states, right? So we know what we know on the tail end of this after all these years as the states that chose. So ACA was signed, it was embedded in part of the hinge were Centers for Medicaid, Medicare Services, and states individually got to choose, or to some degree, how much or little of it they would give the population access to. Not holistically, but that's a summary of it, right? And so when you're reading about expansion and non-expansion states, the states that did not expand, I'm talking Kentucky, Tennessee, like all those people along that belt, that Delta belt, right? And look at the outcomes, right? So the outcomes of chronic diseases were about 11.8% better in expansion states. And that's including the fact that not everybody even accessed it. Right. And so one of the things that I was reading in a book, um, Under the Skin by Linda Villarosa, was how long it took people to be aware of their healthcare rights post slavery in a lot of different areas. In Under the Skin, it said it took a little over 18 years, but usually right before the, get what I'm saying, right before the 18th year, there will be a point where people say, it's enough of that. Let's go back. And this is not, you might think I'm talking about ACA, but no, I'm talking about African American rights to health care post slavery. I'm talking about a lot, and it's literally right before the 18th year. Under the Skin, Linda Villarosa in the First Institute of Medicine report. You ain't got to take my word for it. You can read it for yourself. And so this is history attempting to play out again. And so I want people to be aware of the benefits to prevention and early access to screening and diagnosis for so many people. And I want you to stand up for it in a world where people don't want you to feel entitled. I want you to feel entitled to your health care.
Absolutely.
As much as we know about it and its effectiveness, almost every day I hear colleagues of mine talking about it as if it was the bubonic plague. Honest to goodness.
Yeah.
I mean, railing against it every day. I mean, somehow or another, I be wondering what's the disconnect, or is it that they just have this aversion? And since it was President Obama in office at the time that it was done, that they just cannot bring themselves to say it made sense and was good for the American people.
I know I just got back, but you're absolutely right. I know I just got back, so you know. But I'm gonna say this and I'm gonna back on up. It is exactly that. If you look at the states that chose not to expand it, even though the evidence is there, that it was working and that people do in fact use it once they know about it. And listen, I'm a Black girl from the South Side. I am not a person that goes and just studies historical politics, but certainly some of your colleagues know the politics and the history, and they know it's about 18 years before people begin to really ingrain themselves.
Terrible.
And that's why a lot of that, Dr. Graham, we can't hear. That's why a lot of that is usually attempted to be turned around. Those states that chose not to expand are those states where they actually did a study and they asked people what was ACA, what was the Affordable Care Act, and what was Obamacare, and they literally did not know that those were the same things. And they literally would ask them, like, do you have insurance? Do you want screening? Do you think you should get free screening? And the person would say, yeah, think I should get free screening. And then they were like, well, do you think you should get free screening under Obamacare? And they'd be like, no, because we couldn't, so that is I can name a lot of diseases. There's one called racism, and it really infects people's mind. Like literally one day we're going to look back and find out. You got to be diseased in the mind, especially if you work in service to people, and the very people that can benefit, you choose not to help because of who it came from. And it came across a party line or across a ethnicity or diversity line that you right now, because, you just can't accept. So yes, if you track which ones did not expand Medicaid, have the poorest health outcomes, have the poorest, access to care prevention for literally any disease, those are also the ones that chose to vote differently and act differently during that time.
When you don't like something or somebody, what you do is you create a negative perception about it. Therefore, people will then, instead of them really seeing whatever it is that you are presenting or providing, instead of them seeing what the worth of that, they tend to focus on the misconcepts and the perception of what it is. And so whoever it is that decided to name it, since they were part of the population that had a that didn't want Obama to be the president, and then they fought against anything that he was trying to put in place. So we can put a negative concept on that, a negative connotation to it. Then that creates a thing for some people in the environment to grasp onto and to as Dr. Maya was saying, that all these bad feelings and disease processes such as hate and all those things start to manifest themselves, and now something that is supposed to be doing one thing is become a political football and create all other kinds of things, and therefore it doesn't it becomes difficult for it to really function the way that it should have, because now it's all those misunderstandings that maybe the people who are on the outskirts of things, they understand that I need health care, but they don't want to be related to health care that is supported by certain people, and they felt that if my representatives voted against this, then I must be against it. And so that's why it doesn't make sense, because people then began to reject the things that are there to help them, not because it is not helpful, but because of other kinds of feelings that they have about it, which has nothing to do with what their needs are.
Well, it's amazing just how blatant racism and hatred is running so rampant. To see that people would actually attempt to lose their own lives just because of a name, it really it reminds me of a statement that my grandmother used to make: you're going to cut your nose off to spite your face. Mm-hmm. So basically that's what they're doing, but Audrey J. Cox is here, and she says good evening to everyone. Bonnie Schmetley is here. Hey, Sister Bonnie. And she says good evening just as well. Connie Taylor says good evening, and Nellie Purnell King says good evening just as well. Dorothy Murphy is here, and she says good evening. Pat 4002 says awesome platform. Thank God for Congressman and Miss Harvey for their hard work by continuing to educate our communities. Want to also say hello to Pat Dow, who is here with us just as well. She was here as well. Yolanda Williams is here. Hey, Yolanda. Yolanda is here watching just as well. Jack Orloff is here. Hey, Jack. And Jack is here with us. And there's so many people. Oh, Daniel Allen is here. And Danny says, don't forget to say my name. So, hey, Lieutenant Allen is here with us just as well. Hey, Danny, how you doing? Want to say hey to the guys in the garage. He asked, is this a rerun again? No, it is not. We are live. So there I am. I can see you. We can hear you. You're watching. You are absolutely right. Also want to say hey to Engine Company 79, and also to Sergeant Danielle, who is here with us just as well. You feel good. I hope you feel better very soon. And then we have a new comment that just came in. Oh, Jack has said, hey to my healthcare team. All right. So with that being said, Joe, why would someone cut their nose off to spite their face, for lack of a better statement?
Well, to be honest, I don't think anybody would do it intentionally. But there are things that we do that are unintentional. For example, one of the things that we talk about a lot is the amount of food and the types of foods that people eat. And some of those can cause problems. Too much of it. So you're not eating a hamburger or lots of hamburgers, and I'm not saying there's anything wrong with a hamburger. Anything in moderation is fine. But if you don't eat a healthy diet, you set yourself on a course for some of the diseases that have been talked about. Cancer, heart disease, you set yourself on a course. So it's a double-edged sword. that some of these things will happen because people made bad choices. But what we're really talking about is everybody is entitled to health care, has access to health care in this country. I think we can do it on both ends. People can do better in terms of their choices on a daily basis, but we need to have for all. I have a cousin who, and I thought about this early on. He moved to Paris. He lives in Paris. He's now a professor in Paris. Uh, they have universal health care. He had prostate cancer last year, and he told us he had a great experience and he never got a bill, never saw a bill. There's a different approach to health care in other countries. You don't have to pay for health care. Health care here is really based upon the premise that what we do is we diagnose, people come in, we diagnose disease, we manage disease, and there's a fee for that. And somebody's got to pay the fee. Insurance companies pay a portion, but the expectation is that individuals will pay a portion as well. In other countries, they give you health care. Now, I'm not advocating for anything, but I'm saying there's a difference. In those countries, people don't worry about going to see the doctor because they know they can see the doctor. There's still some problems with people not going, but they know they can go see the doctor. One of the ironies is a lot of these diseases and problems are detected in the emergency room because that's where a lot of people wind up because they didn't know they had a disease. Now they're in an emergency room, which is probably one of the worst places to be if you're sick because you're with a lot of people till somebody can see you to diagnose the problem and find out you had cancer and they don't know how long it can grow in your body for the last 20 years. And you've not seen a doctor in 20 years. So that's the problem. That it's both a problem of individuals. Go ahead.
No, I was going. Do they hold the doctor in the same esteem in those countries that we do here in America? Do they view the doctor the same way? I remember being in Cuba where doctors had to live
right
in the community where their clinics were. And if you went to the clinic and the doctor wasn't there, you run around the corner to his house and say, "Doc, I gotta see you." So that's a question that I just thought of. Is the esteem in which the provider is held? And I don't know the answer.
I would argue that
I'm going to answer the question differently. That I would say what's different is the nature of the relationship. If the doctor lives in the community, he's a community member. If the doctor comes into the community from someplace else, like from Highland Park to Cook County, he's not somebody's neighbor. What they're trying to do is to build this relationship with individuals. So that's a different approach. That has nothing to do with insurance or anything else. That has something to do with a culture of health that's focused on making that there's that relationship. That the doctor knows the people. He's a resident of the community. I was in South Africa. Go ahead.
No, I thought you were done. Before Dr. Hampton, I was going to say to wrap up our last conversation that you and me had, Mr. Harrington. Exactly. Go ahead.
Now I'll finish. My first trip into South Africa, I found out in South Africa because I was actually meeting with people in the health ministry, and I talked about we have a lot of black doctors in the United States. You know what they told me? We get all of our doctors from Cuba because they know how to live in the community and work with the people. There's a difference. They want them to go into the rural area, to live with the people, to understand the people. So that's a different kind of medicine altogether. You know, can a doctor in Highland Park is grown up in a different city, now in Chicago practicing medicine? I'm not saying it's impossible. Can he relate to somebody in North London? Possible, but there may be a disconnect. Some intangibles that we're talking about. And that's one of the intangibles, the ability to make a relationship with people and build trust. That's an intangible in healthcare. You're not gonna believe anybody you can't trust.
I think that's the simple answer, in that you don't have to necessarily live in the community where you serve. I don't live in the Beverly community where I serve. But it's just like a cop. If the cop is in the community and serving that community, there are huge advantages. But some of our best doctors live in Naperville, and the patients love them. It's really more about, do I have access to a competent, patient-centered doctor who gives a crap about me? I think that's ultimately what it's going to come down to. And I think that in other countries, which has more access to care, whether you're talking about Australia or Spain or whatever, Saudi Arabia, I think the doctors are respected there. And that's why in some of these countries, if you don't become a doctor, you're being disrespectful to the family. There's definitely some respect for healthcare professionals in the world. But I also believe that ultimately, if people are given the knowledge and the resources for success, they will follow what the doctor suggests, but it can't be the same old, same old. In my opinion, I'm a little stronger than you, Joe, in that I am being political. I think we should have universal health care, period, because it's almost embarrassing that we don't. I think it's embarrassing that the richest country on the planet prioritizes things that are less important to the average citizen. I know we spend all our money on the military and healthcare. The problem is the people are not the ones who are receiving the check. They're not benefiting. It's that middleman who's receiving the money. That's the problem, because you said we mentioned earlier that bankruptcy was the number one, healthcare was the number one cause of bankruptcy. It's not the number one cause, it is the cause. It's 60-something percent, 62% of all bankruptcies are healthcare related. How embarrassing is that for the richest country? We have to do better than that. And there's no reason why an efficient system where healthcare is the priority and prevention is priority will ultimately lead to reducing the cost. But we unfortunately are in a system that we can't change. And I could only imagine the frustration for our congressman. Citizens United was the worst legislation ever passed. So we live in a country where we are allowed to bribe people. So what do you do with that? So for me, it's a grassroots effort. We take people who get upset like I am, and we fight and fight and fight until things change. I just think that that's the model, because if we do anything else, we're just going to have we're not going to really get anything but crumbs. So we have to continue. We have to educate people. And in my little world of my clinic, when people walk through the door, they're desperate for a healing message. And when I give them a path to heal, oftentimes they do it. You'd be surprised how many people will hear another way. And if they don't have too many barriers in front of them, because we know there's a lot of barriers, particularly on the south side and the west side of Chicago. They will actually do a lot of the things to heal. 2 weeks ago, I took 4 people off of blood pressure medicines who had been on blood pressure medicines most of their life. So we know that this stuff can work, but we have a system that's not really designed for us to take people off blood pressure medicines.
And that's why I struggle.
I can only
It's so essential. I'm saying absolutely necessary. And so we made progress and we make progress. And now we have the MAGA thinkers who say we've made too much.
help to me.
They want to take it back and take it away. And that's why we have to fight them to the finish.
Wow.
I mean, it's been tough getting to where we are. It was not easy.
Right.
And
It won't be easy moving forward.
That's right.
Jeez.
Dr. Hampton.
Jesus. Yes.
What did they do? Because part of it is what you working with them. What did they do to come off their blood pressure medication?
I think for me, it's a great question. It's and I always have to be cautious about my low carb leaning model. But ultimately, and I say it that way because if you are animal-based versus plant-based versus Mediterranean versus whatever, all I tell people is this: you need to recognize that the number one reason why you have high blood pressure is because of chronic inflammation and a high insulin level. And then you say, well, what causes a chronic inflammation and a high insulin level? And the answer is, number one, anything that spikes your blood sugar. So if I have somebody that has a continuous glucose meter, I say this will tell you what to eat and what not to eat. Obviously, processed foods, things high in sugar, and a lot of the starchy foods will spike your sugar. I also remind them if they're struggling, talk to me about stress, talk to me about sleep. So what happens is the primary thing they did was they reduced the starchy, sugary foods. When you reduce the starchy, sugary foods, you automatically eliminate processed food. You automatically are kind of forced to cook at home. So when they do these things, all of a sudden the insulin level goes down. And when the insulin level goes down, it makes you actually, literally urinate out salt. You get rid of salt through your diet. Is that not weird or not? Like literally you have to, some people lose so much salt in their urine, which can raise their pressure, that they have to replace the salt back in their diet. It's the craziest thing. They have less constriction in their arteries. They have, less inflammation. And so what happens is over time, those rigid arteries that have been damaged, not even making nitric oxide anymore, which causes them to open up, they start making nitric oxide again, and they become more elastic. And for some people, that process takes 3 to 6 months. For some people, it takes 2 to 3 years. It depends on how insulin resistant they are. And ultimately, when the body gets a break, they're able to get to the root cause of why they have hypertension in the first place, which is inflammation, chronically high insulin levels, chronic stress, lack of sleep. And so when you focus on those root causes, that's how you get off medicine. You will not get off medicine by being on a blood pressure medicine. It'll just be a bridge. It'll give you temporary support until the healing begins. If you only focus on medicine, the cause of the blood pressure problem will never go away, and you'll just be on medicines chronically. And then for men, that means you can't have an erection. I mean, all of these other side effects that people don't want to take the medicines for, you can eliminate that. I had a guy come in today, and that's how I hooked them. I said, by the way, you have an erection problem. Did you not know that was a warning sign that you're now going to have a high risk for a heart attack and a high risk? So if we fix this little blood vessel problem down there, you may not even need to be on medicines for long. So it's really about helping. And that's what the health system needs to do, Congressman. Teach people what is the root cause of why you're sick. The irony of this conversation, if we can just talk to the people on the other side of the aisle. Because honestly, when Kennedy flipped the food pyramid, I agree with the new food pyramid where you focus on animal protein and vegetables and minimize grains. So if we can agree on something, can we not then use that agreement to then move forward? But the politics is keeping us from making progress. And that's what's hurting us, is that we can't even talk to each other because we all have an agenda. But these things work. And if you have a doctor like myself doing this, there's probably others. Can we then use that as a model for the country so that we can heal more people? Because guess what? Rich people and poor people don't want to be on medicine. Rich people and poor people don't want to have an early demise. So we all have the same long-term goals. We just need a path to, find some things we can agree on. If we can just tone down the politics, and it's just hard to do that in today's environment.
Wow. Well, I want to read a statement from Instagram. And I think I missed her statement before, so she put it back up again. I also want to say hey to everyone over at the Core Center. Hey, everybody at the Core Center. They sent a couple messages. So, hey, everybody at the Core Center. The young lady on Instagram says, Dr. Hampton, you brought up a GLP weight loss drug and how it was $1,600. And then the pill, which is something that you are taking every day, was less than $150, I believe. The gentleman, Joe Harrington, talked about Paris, where Ozempic, Wegovy, and most of the GLPs are only $40. We have a problem with Big Pharma just as well. I just want to put that out there. It was amazing how in Hollywood, insurance companies, which I work for, and I'm an executive at an insurance company that shall stay nameless, paid for stars to be able to have their medications. I'm a pharmacist by trade. However, when they found out that this worked to aid African Americans in getting off some other medications, aided them in losing weight, it began to then protect their heart and their kidneys and move them in a separate direction to healthiness. Now it's an exorbitant price. Just wanted to share that. I know the congressman hears me, and I know that the congressman is a true advocate, and he knows exactly what I'm talking about. And I know that he will try to assist us. Thank you so much for sharing your comment. And yes, you will stay anonymous. So thank you so very much. Dr. Tony, Tony, you mentioned a little earlier about living in communities and how even though now you service people on the south side of Chicago, but you know what? You once lived in the community. You lived on the west side. And I believed if Circle Family Care was still open, I believe you would still be there because that's where you was for like ever. So you knew exactly what you were doing in the community with people, and you were really making a difference over at Circle Family Care. So, I mean, I think what the congressman was saying earlier, it has a lot, that has a lot of weight on it. When you in the community and you see what's happening, you want to invest in your own community. So when you invest in your own communities, you want to see the best for your.
Can I give you an honest reason how I ended up at that specific clinic, besides just being a product of the West Side?
Circle Family Care?
How I ended up at Circle Family Care, other than obviously training at West Suburban, is it was a federally qualified site. So my $200 and some $1,000 worth of loans, they help. I'm just keeping it real. So, but the whole point is we need programs like that to encourage doctors to stay in the communities. $250,000 or whatever that number was over the course of so many years was paid off because I came back to the community that I grew up in. Now, in an ideal world, people do that anyway, but I'm just keeping it real. That's why we need the government to partner to encourage, and you shouldn't have to go to, like, as Joe was suggesting, a completely different country to bring people into a population. We should be able to find, I mean, in America, a lot of our nurses are Filipino, right? Because there was a relationship, right? So but we should live in a country where, and shout out to all the Filipino nurses, some of whom helped train me. But my whole point is, we should live in a world where people are allowed to get into this profession and be in the communities, and maybe we incentivize them to stay in the community they grew up in because we make it easier to do that. And that's okay to do it that way, because ultimately it's a win-win for everybody.
And Dr. Miller still lives in the community, and he worked in the community forever. He retired out of the community, if that's what he wants to call it, because he's back in the community. He's gardening in the community, so he is still working inside of his community. Well, Angela Underwood is here, and she says, awesome, Dr. Tony. Facts. Awesome. So thank you so much, Angela Underwood, for sharing that with us just as well. Well, I know you guys hate to hear me say this because we are 45 seconds over our time, but it is our time. Yes, it is. It's our time. And for all of those people who sent messages, I couldn't get to everybody because the conversation was so robust, but trust and believe we will do some shout outs when we start next week just to make sure we get everybody in. Thank you guys for being here once again. And now we know that you are really watching, because you guys knew that we were at a few reruns a few weeks, but we were in the heat of something. So we had to get through that. And we thank you guys so very much for being patient with us and commenting on the rerun. So thank you so much. As always, we're going to go around and we're going to say our until next Mondays. Want to say March is Women Making History Month, and we want to say hey to all the women and all the great things that you're doing. And I want to say Dr. Sanders, that's David Sanders, the president of Malcolm X College. He's here with us viewing on tonight. I want to say thank you for a great health awareness program that was on last Wednesday and Thursday. It was an outstanding program. Thank you for inviting our office to be there and our office to aid in assisting and making sure that that program was great. The room was filled to capacity with all of our FQHCs being in the room sharing. So I want to say thank you so very much for that. Want to say thank you to the NAACP that will be having their Women's History and Health event at Columbus Park Refectory next week, and we will definitely be there. So I want to say thank you for the invitation for us to be out at that event just as well. Well, Tony, what's your until next Mondays?
Well, I think I always believe that we have to be empowered. And as the world is evolving and trying to align with the vision that may be better for healing, I kind of agree with the tone of the congressman, which is, I need you to kind of grab that baton and run with it. One of the reasons why I bother even making YouTube videos is because I'm trying to give people enough information to grab the baton and run with it. So don't just wait for someone else to save your life. I'll be honest, it's very simple. Eat real whole foods. If it's in a package, pause. You may want to shop on the outer part of the grocery store where the meats and vegetables and the little fruit live. That's where you want to shop. Go in the middle just for some mustard and a few things like that. But don't, if you go to the average shopping cart as I'm leaving, we shop at Sam's as an example. Some of the stuff you see in the shopping carts will frighten you. A whole lot of stuff in packages. Try to stay away from processed food. Eat real food. Move your body. Spring is here, I hope. Move your body. Take a walk. You do not have to be a bodybuilder. You do not have to get a trainer. Just take a walk after dinner. Go to bed at the same time every night. And get away from stressful people. Stop watching the news every night. Let the politicians like the congressman deal with this stuff. I have 6 seniors because they watch the news every day, every hour of the day, and they come to me with a high blood pressure. Stop doing that. Be aware, but don't overconsume it. So just empower yourself, and you'll heal just by doing that.
Outstanding, outstanding. Dr. Miller, you're until next Monday.
I think that we have to first care, and then once we care, we have to care enough that we have a passion for whatever it is that we're trying to do. If we want to be healthy, if we want to live a good life, we have to have the compassion to work on it, to work with it, and to make the adjustment. Nobody came here with was born with knowledge that they're going to that would carry them through life. So we have to learn these things. So spend that. So we all have we always encourage people to learn things that may not be good for you. You can learn to do better, to change. And a change is not always easy. But my grandma always used to say, just because it's hard doesn't mean that you shouldn't do it. Sometimes we have to do the hard work, and doing the hard work means sometimes we have to get away and change from some of the things that we've learned that are not good for us, that are actually bad for us. And so, as Dr. Hampton is talking about what you eat. We pick up habits and so forth. We tend to be creatures of habit as people, but we can change those things and we can learn what it is that we ought to be doing and do that and stop doing the things that are just convenient and they are just things that we're doing out of habit. If we, I remember one time a guy used to tell me, I just can't go by McDonald's without stopping. It becomes that was his habit. He has to stop if he goes by McDonald's. So, sometimes you can change that. You can just keep driving and maybe there's a better restaurant or there's a supermarket that you can pick up some food and take it home and cook it. So sometimes we have to work on things. And I think that is going to give us a much better outcome, something that we're going to be happier with if we make those changes and get away from those things that are hurting us and start doing those things that are going to promote good health.
Outstanding. Thank you so much. Well, Doug, you're until next Monday.
Well, I just want to add on to what the representative was saying is I think we have to be educated about the traps. Because I know when I go to the grocery store, on my right and left are the candy bars and the chips. And that's designed because you're excited, you got food, you're going to eat something. That's the traps. And when you go on the internet, you look at Facebook, you will see reel after reel after reel, people promoting what they think is good for your health, but there's some kind of financial linkage that they're getting paid for this or paid if you buy that product. So the first question you have to ask yourself when you see that is who's getting paid and why are they getting paid? So that isn't enough to know about health. You have to know about all the traps out there to take you out of health and into somebody's pocketbook.
Well, you are absolutely right, Doug, because I was trapped today. I got suckered in the grocery store. I went to get a salad out of a grocery store on Western, no name. And I ended up they had Jay's potato chips on sale, the family size bag, 2 for $5, which meant they were $2.50 each. So I got a bag thinking that I would just eat a few of them. And of course, when you open the bag, it was 70% air and the rest were chips. And I ate all those chips and I feel so bad. My salad is still sitting on my desk. I'm sorry, Doug.
Nikki, they know that. They know how to hook you. They know how to get the cash out of your pocket. So I said, we have to learn the traps.
It's terrible. I feel so bad. I ate every last one of those chips. And I had some Tabasco sauce in my office too. So I dumped that on them chips. It was terrible. It was terrible. So now with my boot, I'm going to have to walk around the block. I'm going to have to walk around the block 10 times. But no more chips for me for the rest of the month. Now, and I haven't had chips in about 6 months. So that was the devil. It was the devil. Well, Joe, you're until next Monday.
Yeah, you better get that devil out your life.
You are absolutely right.
It'll come back again. It'll haunt you. Yeah, well, I'm going to pick up and say that I think Dr. Hampton said everything that needed to be said in terms of what people should do. And it's pretty simple. So I'm not going to rehash that. But what occurred to me and I thought about this at the beginning of this discussion. It's the choices we make every single day that determine, and you sort of hit on that. It's the choices we make, good or bad, that determine how we live and what our health outcomes. And there was a campaign maybe 15 years ago called Everyday Choices. Every day we make choices. All I can say is I'm asking everybody, make better choices moving forward. Make tomorrow a better day by making better choices. And then you won't have to hear us complain about anything anymore, and you will lead a healthy life.
You are absolutely right. Angela Underwood says, eat before you go to the grocery store, laughing out loud. Well, the grocery store was where my lunch was too. But you know what, Angela? Thank you. I got an aha moment. I had to go back to making my own lunch, taking it with me. Then I will not be in that store. Well, as always, Congressman, take us home.
Well, let me tell you, it's been a great discussion. And until next Monday, Saturday is No King's Day, and there are going to be millions of people throughout America. We have a No King's Day in Chicago, but we also decided we'd have our own. And we're going to have No King's Day marching from Pulaski down to the Gold Dome. And of course, people are welcome to join us. If you can't get downtown, there will be probably 100,000 people maybe down there around Michigan Avenue and all those places. So we wanted to make sure that people in the hood who couldn't get downtown could march, demonstrate, activate, do whatever it is that you would do, but find a way to participate. This No King's Day is, of course, being sponsored by myself and Representative LaShawn Ford. Everybody is welcome to join us. We don't need kings in America. We need health care for all. So thank you for your participation. See you next Monday. Thank you. Have a good one.